Hi, I'm Danica Koopmans.
And I'm Sharon Hughes-Geeky. We're your hosts of Docs of Vernon. This is an interview and podcast series designed to help you navigate the healthcare system and get to know the physicians that provide your care.
Topics include what the heck is a hospitalist, treating addictions, and alternatives to going to the ER, plus so many more.
This is your link to healthcare in your community.
Today, I have the privilege of interviewing Dr. Dan Devlin. He is a CCFP, MD, board certified family practice physician, and he works in Armstrong, BC. He completed his residency in Kelowna, BC, and he's a graduate of the University of Alberta as an RN, where he actually worked for 10 years in the emergency department before doing his medical degree. Some of the things he's really passionate about outside of just doing his normal medicine work is quality improvement, including the efficiency of how the practice works and how you can be connected as a patient, and just getting more things done electronically. He also works with medical students and residents, which he really enjoys. And outside of that, he lives life to the fullest in Vernon, BC, Lake Country area, and I guess you could say the North Okanagan Shuswap. Outside of medicine, he plays hockey, he travels with his lovely wife, golfing, and he's a dog and cat dad. He's also kind of just one of those get-her-done people. So welcome, and thank you so much for being here.
Yeah, thanks for having me, Danica.
So I wanted to talk about what a day in the life would look like. Just for anybody listening, what does it look like in Dr. Devlin's day?
Yeah, so I mean, it really changes from day to day, which is good for me. My practice is really kind of a variety. So it's clinic based with coverage for long-term care patients in Armstrong, where our clinic is housed, and then we have some inpatient care that as a clinic we sort of work collaboratively together. There's 5 physicians in our practice and a nurse practitioner that actually joined us this last year, which is awesome. And then for the 5 physicians, we sort of have a mini hospitalist group that we cover our own inpatients at the Vernon Hospital. So depending on what the week would be, if it is a week where I'm covering the hospital for myself and my 3 other colleagues, and it would be spend the morning time in the hospital rounding on our patients, coordinating with specialists and the care for those patients. And then afternoon time would be the clinic is kind of mixed, lots of inpatient stuff. We do virtual appointments, mostly phone calls, that type of thing, and try to serve, I guess, the community as best as possible in Armstrong. And then if I'm not doing that, having my long-term care patients that I will see, and then being a previous emergency room nurse, I think I still work sort of regionally in some of the emergency departments as a family physician. And so usually once a month, I'll probably work anywhere between 3 or 4 shifts in the emergency department to try and help out with some of the shortages that we definitely recognize locally here.
Yeah, and are you often working in the Vernon Emerge, or do you go travel, say up to 100 Mile or Merritt? Or
most of my work has been in 100 Mile House. I've been to Lillooet, been to Oliver, Soyuz, and so some of the other local ones. During residency, I was down in Merritt. I've done stuff in Salmon Arm as well, but since being out in practice, it's mostly been to 100 Mile House. But yeah, there's always lots of opportunities, and so there's lots of availability anywhere near here as well. So
how do you find your work-life balances? Because you're here, there, everywhere with your job, but you also mentioned, getting outside, and that's a priority.
Yeah, totally. I mean, I think I tried to institute that pretty early in medical school, and then even through residency. And I was lucky that my residency program in Kelowna, that was really kind of one of the big things, that they wanted to have a good work-life balance and nice holistic approach to residency. And I think I've kind of continued that on into my practice. I when I work, I am working hard, and I expect that I need to work hard, but when I'm able to take vacation, I will, and so definitely try to prioritize making time for myself, my family, and just to get away from it, because I think it kind of keeps you fresh and everything as well.
So when I had mentioned in your bio, and you had also said about coming to the Okanagan, why did you choose Armstrong?
That's a good question. So yeah, so going back, I was previously an emergency room nurse and did that for 10 years in Edmonton, and decided I wanted to go back to med school. It was kind of always sort of a plan that I wanted to do when my other part of my life, sports and everything, sort of settled down. And so I decided to go back, and unfortunately, I wasn't able to get into medical school in Canada. So I did go abroad, and so because you go abroad, you become an international medical graduate. And I was lucky enough to finish medical school and then match back into a residency program in Canada. But because you've done that, you become an international medical graduate, and there's a return of service or a requirement to work in an underserved community. Um, for at least 2 years once you've graduated. And I was actually lucky enough that one of the return of service communities was Armstrong, and it wasn't really too far from where I lived. And it actually ended up being sort of a perfect storm. Like the group that I work with here, like, share a lot of the same sort of ideas: busy outdoors, work-life balance, wanting to have variety in their practice. Everyone does, all of us work here in this clinic, and, this isn't the only part of our practice. This is just part of it. And then we all do sort of like other things that we have some interest in. And, my requirement was only to spend 2 years here as part of the return of service, and then I could really go and do whatever I want. And now I'm close to finishing my fourth year here, and I don't see myself really going anywhere. So yeah, no, it just ended up being perfect spot.
That's really special because sometimes we don't know where life is going to take us, and you've just done it. And now here you are, and what a gift to the community.
Yeah, really lucky though. Like the place, it is a great place. So
is your clinic fully staffed, like, or could you still take on more people if they were interested in just what you're talking about, the variety? And really you're doing like old school medicine,
I know.
way where medicine used to be in a supportive environment.
I know. Well, and it's, it is. And I think the sort of the reputation, that's what I'm looking for. The reputation of our clinic is like, it's a great clinic to work with and everything. And so, we actually are lucky that we have like sort of a group of locums that do like to come and work out with us and everything here. So if we do take some time off, obviously we're always looking for more because we do like the work-life balance, and it's nice to have coverage. If we can't find coverage, like it's such like collaborative clinic that, we'll cover for each other if people are gone, and checking on results and that type of stuff to make sure that, our patients are fully covered. I think if we're looking for more staff, or like if you're talking about physicians or nurse practitioners, we're certainly open to that for sure. I think the building that we're actually in, we're close to our capacity, what we could handle, but there's been talks previously with sort of the people that own the building of, an expansion and everything too. And, we have sort of the bottom part of the building that is being used, but I think if there's a way for us to expand our medical community in Armstrong, there's definitely an appetite in like the city of Armstrong to actually do that as well.
Especially because I know the other thing is you're working with a lot of medical students and residents. And so what is that like to bring them on, and what some of their experience, and how is it teaching?
Okay. Yeah, no, in terms of having med students and residents here, I think it's a great opportunity for the clinic. I think our patients love it, the staff love it. You always have a variety of faces and fresh faces that are, happy to be here and eager to learn. And I think for us that are doing the teaching, kind of causes us to be on our toes a little bit. The med students and residents are so inquisitive. They're always, reading up on things, asking questions. And so, well, I read this. What do you think about this? And it's like, oh my goodness. Like, I got to remember this type of stuff. So kind of keeps us on our toes. It keeps us a little bit fresh. And then it's really nice to see sort of the evolution of, the med student transitioning into the resident, and, what kind of physician that they're actually going to be. Currently right now I have a first year family medicine resident. There's a new residency program in Vernon that's just started this year, and it's been great. It's been, awesome to have sort of that consistent new learner with us all the time, and then they're themselves are doing great, which is good, and it helps us out. And then I think probably this second year coming up, we'll probably have another resident that will join us sort of full time in the clinic. And the hope is that, by doing this and there's good experiences, that it will, also attract maybe some future physicians to come and work and live in the area as well. well. And from what I've heard, most of the residents, or I guess all the residents, are enjoying their time here. So, hopefully it continues and we sort of be a destination for residency, but then also to sort of retain those residents when they come through here.
So I want to end on a fun note. What would you say is your favorite pastime here in the Okanagan?
You already know the answer. Yeah.
I had to.
I know.
Lure you into it.
Yeah, exactly. No, obviously like the outdoors, and I'm kind of a sporty person, but golf is definitely my sort of go-to. The season's long. There's tons of courses around here. And so I think I'm getting better sometimes, and then there's times where I'm like, oh man, I'm getting way worse. I think we did a promo for our residency program, and the program director had kind of put a little corp at the bottom. It's like Dan Devlin, semi-pro golfer, and it's like I think I'm like the lower end of the semi-pro. It's definitely further away from the semi or from the pro portion. So my partner, she loves golf and everything, and so we do lots of golf in and around the area. Our friends come to golf. I mean, lots of our vacation is sort of keyed in upon. It's like, well, could we golf while we're gone, kind of thing. So it is kind of a nice accessible thing here that we really like to do.
That's awesome. No, the Okanagan is for sure the place to be golfing.
Oh,
Because
yeah.
I mean, what, the season starts May and ends
No, it starts in March. We like,
March.
yeah, it's like a probably 8 months you can golf here.
Wow, that's incredible. How fun is that to know? And see, you just shared with the public and anybody else listening some very valuable information.
Very valuable information. Yeah, exactly.
Well, on that note, was there any last minute thing you wanted to share just with the people watching today?
No, I just think if you are considering, coming or making a change or wanting to explore different places to work and live and everything, I hope that you give kind of like the North Okanagan, Vernon area a look, because there's a lot of great people, there's a lot of great activities, outdoors, winter, summer, doesn't really matter. And the opportunities are kind of endless in terms of how you'd want to sort of shape your practice, or a practice that you'd like to work with part-time. So I hope that people consider doing that. And if there's, I'm always open to having people reach out to me. So if there was questions about it, be happy to chat with someone. And yeah, hopefully we see you one day.
Yeah, absolutely.
Yeah.
Well, thank you very much for being here. And thank you everyone for watching and listening in. Again, like Dr. Devlin said, if you had any questions or you wanted to connect with somebody at the clinic or in Armstrong, we'll have all the links below for that. And thank you. We'll see you next time.
Thanks so
Bye.
much, Annika. Okay, bye.